how I became a uveitis specialist, so I have to go back almost 3 years short of 50 years. When we were running all specialty clinics, and all of us were expected to be kind of excel in each of the specialties of ophthalmology, especially because my chief had been trained in UK, and there the emphasis was that anybody who's a comprehensive ophthalmologist had to have excellence in all specialty areas. So what I'm going to be sharing with you is the story of a hare and the tortoise. There were no hare in my times, and nowadays you have you can do a 2 or 3 years fellowship in a program, and you can choose the kind of route which you are going to take and become a specialist. You wear that chip on your shoulder, 30 something, and the courtesy, of course, you borrow it from the charismatic programs or charismatic mentors that you train with. I followed an organic path. I followed a path because there was no choice. The organic path is full of potholes. You slip up so often. You get up, you brush your clothes, you move on, and become a little wiser, like the proverbial tortoise. Now, I lived in an era where there was a total information vacuum, and we had to depend upon some of the textbooks which our teachers read and they recommended. These were expensive. Those were the days where like I could get hold of only 3 volumes of the System of Ophthalmology by Duke Elder. And of course, a 2-volume, second volume of Arnold Sorsby, with whom my chief had, sometimes worked back in London. The only book available at that time on endogenous uveitis by Alan C. Woods was not available in our library. Now, we had to keep hearing the names of Perkins, who co-authored this book with Duke Elder, as well as Alan C. Woods over the next several years. And, my chief was very, very interested in systemic aspects of ophthalmology. He was very conscious that the ophthalmologists were looked down upon by other disciplines in medicine, and they would say these are the guys who don't wash their hands and they remove the cataracts and they don't do anything. So he kind of challenged us to follow his path in pursuing the field of systemic aspects of the ophthalmology. Now, the turning point number 1 came when he gifted me, somewhere around 1980, he gifted me with a Fundus camera. Now, this became a great passion with me. And he used to emphasize all the time about documentation of the patients. In his own days, he had published a lot of work based on simple ophthalmoscopic documentation and his notes. When he gave me the Fundus camera, and I used to do almost like 20, 30 angiograms a day, and every day was a revelation. I'm talking of now almost like 40 years ago, when I started doing these angiograms. I mean, it was revelation. You look at the NVEs, NVDs, CNVMs, microaneurysms, you see the vessels inflamed, you see a lot of pathology. And every time you had to go to the library to see what it all was about. So it was a very, very challenging field, as well as very, very fascinating. The most important lesson I learned at that point was that the pictures don't lie. If your patient is responding to your treatment, the camera would show. If your patient is not responding to your treatment or intervention, it would tell you that, look, buddy, you are not doing well. Your patient not doing well. So it was a great lesson to learn from the Fundus camera. Until date, I believe the Fundus camera next to my chief was the best teacher I ever had, and still I believe that. In those early days in 80s, I got fascinated by these young girls presented multifocal lateral detachments, were showing exuberant pockets of, serious detachments in the fundus. And I used to call these patients limited Hare disease. And I first presented my data in an AIOS conference in Mumbai in 1988. And so happened, and this became a turning point for me because Narsing Rao, I think it was one of his visits to India at that point of time, was chairing this session in which I presented a spectrum varying from APMPP to VKH disease. Remember, this was the time when a formal, description and its stages and treatment was yet to come. Narsing Rao had the advantage because he was a pathologist and he had reported long back, a sympathetic and ophthalmia mimicking each other. He had published that work, but his clinical work was yet to come years away. I got an opportunity to present my work at ICO and AAO, but because of financial constraints, somebody else had to read my papers in both these international meetings. Subsequently, as you know, his rest is history. VKH became a passion with Narsing Rao, went on to publish more than 45 papers on this subject. The next turning point was my collaboration, and perhaps we were the first in the world to start a clinic with a rheumatologist, Professor Pradeep Hambari, almost like 35 years ago. And a single straight remark from him: how come your patient Uveitis clinic shows such high necrotic TSTs, skin reaction, that I don't see in my clinic in the medicine department? And this led us to work on tuberculosis. Around this time, fortunately, the PCR techniques had been introduced in India, and I'm talking of very early 90s about this time. And we managed to get hold of these few papers in the 90s with the help of Professor Shobha Sehgal, who was professor of immunopathology, and Sunil Arora, who carried out most of this work. I managed to present these work in 1998 and 1996, the 54th AIOS conference in Chandigarh, and again in our work in 98. 98 would also turn to be a turning point for me. You can see your chairperson Ratinam here, Narsing Rao, my chief here, and I was introduced to a number of international experts, including Amod Cunningham. The next turning point was, impressed with our work on PCR and tuberculosis, Dr. Narsing Rao kind of emphasized and impressed upon me to present my work on PCR positive tubercular retinal vasculitis in the only meeting that was held of IUSG that was held in Fisherman's Cove, Chennai in 2001. In more than one meaning, it would turn the tide in my favor. We subsequently published this paper. Now, I'll go back a little, almost like 14 years before the Fisherman's Cove meeting. And here is this Anita Agarwal, who joined me as a resident somewhere in mid-87. And I was fascinated at that time, as I said, the diagnosis of APMPP, and my chief was very fond of diagnosing every patient as APMP. When we would see these patients, they had large, big scars. And I told her, let's look at, see how did these lesions begin with. And we poured over several hundred pictures and angiograms, and she would be able to procure a Xerox copy of the Don Gass Stereoscopic Atlas of Macular Diseases. She remained with me for about 5 years, then went to the US. She did her fellowship in residency. She did her fellowship with Don Gass and would ultimately become a faculty member with Don Gass, became his colleague, and she would also go on to edit the 5th edition, of which she had earlier gifted me a Xerox copy. She would go on to write the 5th edition of this so famous book. So we published this work in 2002 in AIOS It was a lot of work. It was almost like experience of more than 10 years. And as you can see from one of these examples which we published, this was a follow-up of looking at these pictures and angiograms over a period of almost like 8 to 10 years for each of these patients. And we came up with this kind of work which I presented in the International Symposium on Uveitis that was organized by Jyoti Biswas in 2001. I was introduced already to Emmett Cunningham, but he was so fascinated by my work on serpiginous choroidopathy that he introduced me for the first time with Carl Herbert, who would go on to become a lifelong friend and a very, very cherished friendship I have enjoyed with Carl Herbert ever since. They had a very lengthy discussion on what it was, and they actually prompted me to publish, which they thought was the largest experience in the world, the cumulative experience on serpiginous lesions in the eye. And that's what we subsequently published. And of course, the offshoot of this experience was our paper when we linked some of those patients of serpiginous-like choroiditis with tuberculosis, and this paper would go on to become one of the most cited papers in the field of uveitis. There were a lot of hard work had gone into establishing a link with tuberculosis in just these 7 patients. It took a lot of hard work to try and link tuberculosis to this disease entity. I had the fortune of having a team with me from different times, different time points, who had absolutely implicit faith. I had Dr. Sunil Arora, who did the initial PCR for us, followed by Kusum Sharma, the professor of microbiology, who is continuing that work. Aman Sharma, the professor of rheumatology and clinical immunology, who has worked with me for several years subsequent to Professor Bambring shifted to Australia. The Rima and Ramandeep and Vishali. Now, 4 of us became members of the International Uveitis Study Group, Vishali being now the secretary of this esteemed group. And I think there will not be too many examples from the institutes anywhere in the world where 4 members belong to this exclusive club of uveitis. There were a lot of international experts led by Professor Narsing Rao, Manfred, Amod, Luca, Ilknur, Pijang Yang, Monsef, and Carl, who went on to, with me and Vishali, went on to write a book on uveitis. And the biggest reward for me personally was on a visit to the Vanderbilt Eye Institute in the US in Nashville, early morning, 7 o'clock, when Don Gass himself was not very well. At that time, he was already undergoing treatment for his pancreatic cancer. He traveled 45 miles to be there at 7 o'clock to hear me talk on the serpiginous choroiditis and its link with tuberculosis, and he was thoroughly impressed. And that was my biggest reward, because something which prompted me to follow in his footsteps, following those patients who started as multifocal choroiditis lesions, what we called at APMPP at that point of time, ultimately led to this diagnosis, which is now recognized all over the world and treated so. Do I have any regrets following this path? No, because most of my publications in uveitis have fetched me very, very high citations. Almost 60% of my papers, highly cited papers, have come from this discipline. Now to summarize, now times they are changing. Now the hairs will not allow a poor, slow-moving tortoise to win the race, no question. So you must all aim for a fellowship train. But please don't wear that badge of honor on your shoulders all your life. You got the training, fair enough, but don't wear that chip on your shoulder. Patients still remain your best teacher and the best resource to continue to live and learn all your life. Document each and every patient, every visit they come and present to you, because from there only you are going to learn for yourself whether you're on the right path or you're on the right track. They are the real lifelong teachers. I would urge you again not to fabricate data. But if you observe something unique, you stand by your observations. You present your data in meetings. The meetings and conferences are like a touchstone. You will realize whether you are working in an echo chamber, nobody else is kind of, sporting your data or your observations. You must, when you work alone, it's impossible to become an expert problem solvers. You must continue to work in a community of experts. Wherever there are more than one experts available, you must, and also work in a multidisciplinary environment to move ahead in times. People who just write papers and don't present their data in meetings, they go, anonymous. Nobody puts a face. So I urge you to put a face to your papers and write those papers so that people recognize you and recognize your work as well. Thank you very much for giving me this opportunity to share some of my thoughts on how I became a uveitis specialist. Thank you.
Thank you, sir. Thank you for a wonderful talk. It was very inspiring and we learned a lot. Thank you so much.
Thank you.
I think it was a very inspirational talk, and it really has a lot of us as delegates also would be inspired to take up uveitis as a specialty, sir.
Of course.
You are teacher of teachers, Dr. Amod, sir. We are privileged to have you, sir.